With type 1 diabetes, the body does not make any insulin and therefore insulin has to be injected regularly every day to stay alive. With type 2 diabetes, the body does not make enough insulin, or the insulin that is made does not work well. So, what is insulin and types of insulin? Insulin is a hormone that produced in the pancreas by beta islets of Langerhans. Insulin moves glucose from your blood into cells all over your body. Think of insulin as the key that opens the doors of the cells in your body. Once insulin opens your cell doors, glucose can leave your bloodstream and move into your cells. Without enough insulin, glucose can't get into your cells and instead builds up in your blood, causes hyperglycemia. Insulin helps for the uptake of glucose from blood to cells. Insulin shifts potassium into intracellular space, therefore potassium will reduce in blood. That's why it is used for hyperkalemia. Insulin helps for glycogenesis in liver and muscles. Types of insulin: rapid acting, short acting, intermediate acting, long acting, ultra long acting. Common rapid acting insulins are Lispro or Humalog, Aspart or Novolog. Their onset is 15 minutes, peak 30 minutes, and lasts UPTO 3 hours. This insulin is high risk for hypoglycemia, so meals should be ready. Next is short or regular insulin. Tip usually ends with R, Humulin R, Novolin R. It is clear. Usually given before meals. Only 4 insulin. Onset 30 minutes. Peak 2 hour. Lasts UPTO 6 to 8 hours. Next intermediate. NPH insulin. Tip usually ends with N, Humulin N, Novolin N, it's cloudy. Onset 1 to 2 hour. Peak 4 hours. Lasts UPTO 16 to 24 hours. Next is long-acting. Tip L for long. Lantus or Glargine. Levemir. Given once daily. Usually before bed. Never mix with other insulins. Onset is 2 hours. No peak. Lasts UPTO 24 hours. Finally ultra-long. Degludec. Given once daily. Slow release. And lasts UPTO 48 hours. There are premixed insulin like Humulin 70/30ths. Means intermediate 70% and regular insulin 30%. This helps to reduce injections per day. Tip: when mixing these insulin, remember RN. Regular first, then NPH. Sites of injection. A person can administer insulin injections into the abdomen, upper arm, thigh, lower back, hips, or buttocks. Injections into the abdomen are the quickest route for insulin to reach the blood. The process takes a little more time from the upper arms and is even slower from the thighs. Angle of injection. For pen insulin this should be a 90-degree angle and for syringes a 45-degree angle. Side effects. Hypoglycemia is the most common side effect of taking insulin. Symptoms are feeling hungry, feeling dizzy, trembling or shaking, headache, confusion, blurred vision, sweating. A quick review now. Insulin is a hormone that your body makes to help move glucose from your body's bloodstream into your cells. Your cells use the sugar as fuel for your body. If you have type 1 diabetes, your pancreas doesn't make insulin. If you have type 2 diabetes, your body doesn't make enough insulin, or it can't properly use the insulin that it makes. Without enough insulin, the sugar will stay in your bloodstream, causing high blood sugar levels, hyperglycemia. In order to correct that, we use man-made insulin that's similar to the insulin made by your pancreas. This extra insulin helps to control your blood sugar and prevent complications of